Hi, this is Dr. Paulomi Mukherjee. I'm a surgical oncologist working in Cachar Cancer Hospital. I have been with this hospital for the past 12 years, and I have seen the hospital grow from a two-building institution to the current state that it is in. I've seen the hospital grow from 500 patients in the OPD a year to 5,000. That's the caseload we are handling, new patients per year. I have seen the Silchar town grow from a small town to a largish city. So the patients that we cater to in this hospital are from the districts of Cachar, Hailakandi and Karimganj. These are the districts in Barak Valley. And most of the patients are, they are the manual laborers, and they are a family on an average, they are a family of 5 or 6 depending on a single wage earner, breadwinner. So when that particular person gets affected by cancer, it's just not the person or the patient, but the entire family is afflicted. When we get involved with the patient, we cannot just look at his treatment, but it is an entire process. We get involved with the entire family. It is from the stage of diagnosis when the patient comes to us, to treatment, to rehabilitation. And when we are talking about rehabilitation, we have to take into account the family as a whole instead of just the patient. So all this process requires a huge deal of resources. And the current problem that we face is a huge deficiency in resources, in terms of human resource, in terms of financial resource, in terms of infrastructure. When I do my OPDs, like I told you, from an OPD of 500 patients a year, we get to see almost 5,000. And when we interact with the patient, a whole lot of resource starts. We need a whole lot of resource at that point of time when the patient comes in, and we have to convince him to take the treatment. Now, cancer treatment, the treatment as such requires a lot of, other than support, it requires a lot of other multi-specialty involvement. The patient may require surgery, chemotherapy, radiation therapy, and every step of treatment, patients also require help from the nutrition side. They need dietitian support. They need physiotherapy. They need physical rehabilitation. They need occupational therapy. So this is when we talk of treatment and rehabilitation, these are not a standalone stage. All the stages come to play at each and every step the patient takes towards completing his treatment. Therefore, the cancer treatment involves a great deal of resources, and that's something that we are trying to amass. We're trying to get the people help us in getting these resources together for a patient who comes from a background of, say, a day laborer or the tea estate laborer. So these are the majority of our patients whom we extend the cancer care to. For my specialty, that's surgery, if we just look at it, it's just not a matter of operating on a particular patient and then letting him, after he's well and his wounds heal, we let him go. It doesn't end at that. During the surgery itself, it's a matter of using state-of-art instruments, state-of-art devices, state-of-art anesthesia to make sure his stay is not prolonged than what it should be in that particular surgery. Cancer surgeries, as you all know, these extend long hours. Regular surgery would go on to 6 to 7 hours. So the operation theaters, the anesthesia backup, it has to meet that level so that we are able to do justice to the surgery, and we are able to meet the current standards of surgery the kind of standards the rest of the world are used to. So this is what's with our effort, we are trying to come up to those standards, irrespective of lack of resources. We are trying our best, putting in our efforts so that a patient still gets the state-of-art treatment.